One of the questions that I get asked a lot is whether or not an IUD would be a good idea for women in perimenopause who are considering menopausal hormone therapy. So the short answer is yes. The longer answer is it also depends on you, your comfortability, your goals, and what kind of symptoms are going on. Where it may be helpful. Certainly, if you're having menstrual irregularities, sometimes periods get very heavy and unpredictable during perimenopause. And so this can be a place where it's helpful and beneficial, slowing down that bleeding or stopping that bleeding. And so you're not caught off guard. So that's someplace that it could be helpful. It also may be helpful if you have, obviously, you have a uterus, if you're getting an IUD and you're considering menopausal hormone therapy, because then you don't necessarily have to worry about the progesterone piece. You don't necessarily have to have oral progesterone, but it still may be beneficial for you. And that's a discussion you can have with your provider. And you absolutely, yes, can have a progestin-releasing IUD and be on oral progesterone. That's totally fine. Of course, another reason is, you're still cycling and you don't want to get pregnant, right? Most women, I would say, who are heading down this path don't necessarily want a surprise pregnancy. So that is yet another reason. And then you can discuss with your provider whether it's helpful and appropriate for you to be on other menopausal type therapies, progesterone, estrogen, testosterone, etc. And you don't necessarily have to worry about the birth control piece. So those are some good reasons. But again, it all depends on you, what your goals are, what your history is, what you're comfortable with. And it's a great conversation to have with your provider, and certainly one that I have with my patients all the time.